Hello students, I welcome you once again to study session 11 of this module, which is nursing process. It's an important aspect of nursing profession. Without knowing nursing process, to practice effectively as a nurse will not be easy. Please sit back and enjoy this lecture. Moving to the introduction, the common trend uniting different types of nurses who work in varied areas is the nursing process, which is the essential core of practice for the registered nurse to deliver holistic and patient-focused care. At the end of this study session, you should be able to discuss nursing process, its purpose and characteristics. You should be able to describe the steps involved in nursing process, and you should be able to explain nursing process theory and its assumptions. What is nursing process? Nursing process is a systematic approach to identify and treat client needs in response to illness. It also provides framework for nursing practice, developing care plan in an organized and systematic way. By using the nursing process, nurses are allowed to communicate their role in planning and executing client-centered activities to clients and their families. It is a process that encourages orderly thought, analyzing and planning when working with clients and deciding on what care needs must be met. Well, let's go back into the history of nursing process. The nursing practice was first described as a four-stage nursing process by Ida Jane Orlando in 1958. The nursing process uses clinical judgment to strike a balance of epistemology between personal interpretation and research evidence, in which critical thinking may play a part to categorize the patient, issue, and course of action. The evolved nursing process being discussed in this study session includes the array of clinical decisions that must be made during a patient encounter, including assessment decisions, a diagnosis, choice of interventions, and identification of outcomes. The purpose of the nursing process is to identify the essence of care, is to organize or create a plan to meet the goal of care, and be as creative as flexible as possible in order to meet that goal. In doing so, the nurse is able to provide individualized, holistic, effective, and efficient care to the client. What are the characteristics of nursing process? Nursing process must be systematic, interactive, purposeful, and systematic. It has an ordered sequence of activities at each activity depends on the accuracy of the activity that precedes it and influence the activity following it. Also, nursing process are client-centered. Nursing process should be dynamic. Nursing process has great interaction and overlapping among the activities, and each activity is fluid and flows into the next activity. Nursing process should be interpersonal. Nursing process should be within the legal scope of nursing. Nursing process must prioritize the needs of an individual, and the steps are interrelated and dependent on the accuracy of each of the preceding steps, like I have said. A nursing process is used to identify, diagnose, and treat human responses. Nursing process being interpersonal ensures that nurses are patient-centered rather than task-centered, and encourages them to work to help patients use their strength to meet human needs. In being goal-directed and outcome-focused, the nursing process is a means for nurses and patients to work together to identify specific goals related to wellness promotion, disease and illness prevention, health restoration, and coping and altered functioning, which are most important to the patient, and to match them with the appropriate nursing actions. Nursing process should also be universally applicable. It allows nurses to practice nursing with well or ill people, young or old, in any type of practice setting. What are the benefits of using this nursing process? Nursing process helps to achieve scientifically based, holistic, individualized care for the patient, which is part of the characteristics of nursing process. Nursing process also encourages the opportunity to work collaboratively with nurses. It helps to achieve continuity of care. It helps to minimize error and omissions in care planning. It helps to promote critical thinking, decision making, and problem solving. It is outcome focused and encourages the evaluation of results. It enables you to individualize care for each patient. In using nursing process, the care you give to a particular patient is different from the care given to another patient, depending on the condition of the patient and depending on the moment in time. Looking at steps of nursing process. The nursing process is a scientific method that is used by nurses to ensure the quality of patient care. This approach can be broken down into 5 separate steps. The first step of the nursing process is the assessment stage. And during this assessment stage, the nurse will gather information about the patient's psychological, physiological, sociological, and spiritual status. This data can be collected in a variety of ways. Generally, nurses will conduct a patient interview, physical examinations, referencing a patient's health history, obtaining patient's family history, and general observation can be used to gather assessment data. The next phase is the diagnosing phase. The diagnosing phase involves a nurse making an educated judgment about a potential or actual health problem with the patient. Multiple diagnoses are sometimes made for a single patient, and this assessment not only includes an actual description of the problem, but also whether or not a patient is at risk of developing further problems. Once a patient and nurse agrees on the diagnosis, then the next thing is a plan of action can be developed. During planning, the nurse establishes priorities, writes patient goals or expected outcomes, and develops an evaluative strategy to achieve that. You select nursing interventions and communicate the plan of nursing care. The next phase is the implementation phase, whereby the nurse carries out the plan of nursing care, continues data collection, and modifies the plan of care as needed. Then you document the care. The last phase is the evaluation phase. During this phase, the nurse measures the patient's achievement of the desired goals and expected outcomes. You identify factors that contribute to the patient's success or failure. Then you modify the plan of care if indicated. Let's look at nursing process theory. The nursing process was based on a theory developed by Nurse Ida Jean Orlando, and this theory delves into the purpose of nurses and their requirements in the medical field. This theory assumes that a patient who cannot cope with their medical needs without assistance will become distressed and begin feeling helpless. At the base level, nursing can contribute to this distress. However, Orlando theorized that the nurse-patient relationship is one that is decided by both parties, that is the nurse and the patient. The patient cannot appropriately convey their needs or fears without first establishing a close relationship with the nurse. This theory states that it is the expressed role of the nurse to find out what the patient's immediate needs are. Then you help and fulfill them. Unfortunately, the patient will not always express their distress in a way that determines exactly what kind of help is needed. Therefore, it is your job as a nurse to use your insight, your perception, and your intuition to figure out what the patient's true needs are. This process of examining the patient behavior and discovering its meaning will always assist nurses in finding out what the client really needs. The nursing process theory is all about staying focused on the patient's needs. If you are studying to become a nurse like you are studying now, you simply remember that the patient always comes before anything else. Thanks for listening and have a good day.